Expectant mothers must exercise extreme caution when taking medications during pregnancy, even those that seem harmless. A new study has added to the growing body of research linking the use of paracetamol, also known as acetaminophen, to an increased risk of attention deficit/hyperactivity disorder, ADHD, in children. This is not an isolated finding, but part of an alarming pattern emerging from multiple studies over the years. Yet, despite these concerns, paracetamol remains one of the most widely used pain relievers during pregnancy, often recommended without serious warnings about its potential risks. Pregnant women deserve better information and stronger precautions to protect their unborn children. The latest study, conducted by researchers at the University of Washington and published in New Scientist, followed over 300 pregnant women in the U.S. Unlike many previous studies, which relied on self-reported medication use, this research used blood samples taken from the women, providing a more reliable measure of paracetamol exposure. The researchers then followed up when the children were between 8 and 10 years old, checking for an ADHD diagnosis. The findings align with previous concerns, suggesting a troubling connection between prenatal paracetamol use and an increased likelihood of ADHD. While not all studies have reached the same conclusion, the pattern is impossible to ignore. A 2019 study found a 20% higher risk of ADHD in children whose mothers used paracetamol during pregnancy. However, another analysis published last year found no difference between siblings who were or were not exposed to the drug in utero. These conflicting results create a dangerous situation for pregnant women. Without definitive guidance, they are left to make difficult decisions with limited and often misleading information. Medical authorities must take a more aggressive stance in investigating and addressing these concerns instead of continuing to downplay potential risks. The problem lies in the outdated assumption that paracetamol is completely safe for use during pregnancy. While organizations like Pluckett in New Zealand continue to recommend consulting a doctor before taking the drug, the overall message remains that it is generally safe as long as dosage guidelines are followed. But if multiple studies suggest a potential link to ADHD, then the question should not be about dosage. It should be about whether the drug should be used at all. The lack of a conclusive ruling should not be mistaken for evidence of safety. Instead, it should be treated as a major red flag, signaling the need for more caution, more research, and more transparency. Regulatory agencies have been slow to react to these concerns, and pharmaceutical companies have little incentive to sound the alarm. The reality is that expectant mothers cannot rely solely on medical authorities to warn them of risks that have not been fully explored. They must take proactive steps to minimize unnecessary medication use during pregnancy, especially when the potential consequences include long-term developmental disorders. The stakes are too high to ignore these warnings. Pregnant women should question whether any medication, no matter how common, is truly necessary before taking it. Alternative pain relief methods should be considered first, and doctors should be pressured to provide clear, research-backed recommendations rather than vague assurances. The scientific debate surrounding paracetamol and ADHD is ongoing, but until it is settled, the safest approach is to avoid unnecessary risks. Parents should not have to look back years later and wonder if a simple pain reliever contributed to their child's struggles with attention, learning, and behavior. This is a preventable risk, but only if the right precautions are taken now.